الأستاذ الدكتور أحمد أبو الفتوح، أستاذ الأشعة التشخيصية في مستشفى الحسين الجامعي جامعة الأزهر. طبعا معنا الآن الأستاذ الدكتور أحمد أبو الفتوح، أستاذ الأشعة التشخيصية في مستشفى الحسين الجامعي جامعة الأزهر. أغلب الحاضرين تعلموا على يديه، أستاذنا الكبير صاحب الصدر الكبير العملاق الذي له محبين في الوطن العربي. طبعا الدكتور أحمد أبو الفتوح من المميزات أنه كان يعمل في اليمن تقريبا قبل 15 سنة. تمام. فالدكتور احمد بن الفتوح لديه كورسات طبعا لكل طلاب الوطن العربي في مستشفى الحسين، وكل يعتبر قبلة الراغبين للعلم لديه. فاستاذنا العزيز، هل تسمعني دكتور؟
ايوه اسمعك.
حياك الله. حياك الله دكتور. طبعا محاضرة الدكتور role of the Doppler ultrasound in the peripheral vascular penetrating injury. فدكتور نترك لك المايك والميكروفون ويبدا.
تسمعني دلوقتي؟ تسمعني؟
نعم نسمعك دكتور، نسمعك والصوت واضح والصورة ما شاء الله عليك، منور دكتور.
بسم الله الرحمن الرحيم، والحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين، وعلى كل أنبياء الله جميعا. أحبابي وأهلي وإخواننا الكرام في اليمن الحبيب، أنا يقشعر جسمي الآن وأنا أكلمكم وأتحدث معكم لما في ذلك من محبة ليكم جميعا ودعوات من قلبي أن الله يصلح حالنا وحال اليمن يا رب ويجعلنا كده على الطريق. النهارده حقيقي ببتدي أرحب الأول بكل القاعدين النهارده، كل الجالسين في المؤتمر. ترحاب شديد جدا على ان هم يحضروا المؤتمر دهوت ويشجعوه، فلكم جميعا كل الشكر. وايضا لرئاسه المؤتمر بالكامل، واحيي طالب الجميل الدكتور المحترم منير وكل زملائه اللي درسوا معايا من اليمن في مصر. دكاتره كتير جدا حقيقي، بنحس عمرنا ما حسينا بفرق حقيقي بيننا وبينهم. إلى أهل اليمن جميعا أحييكم من مصر الحبيبة وإلى يمننا الحبيب. أنا آسف كان لازم أبتدي الدخلة دي، لأن أنا مبسوط قوي إن أنا أكون معاكم، لأني إن شاء الله سنكررها وعلى أرض الواقع بإذن الله تعالى. محاضرتنا النهاردة أو يومنا النهاردة هنتكلم عن حاجة very crucial, rule of Doppler in cases of peripheral vascular penetrating injury. And quick, actually I need to highlight some points. ايوه انا عامل ايوه على الشيت محاضره. بصري تمام كده؟ تمام. طيب يبقى احنا هنتكلم عن rule of color Doppler ultrasound in peripheral vascular penetrating injury. وهنهايلايت على some points. This is the lecture outline. I will speak an introduction with some long time، يعني تقريبا introduction هتاخد ست المحاضرة أو نصها. Some general aspects, type of vascular injuries, points of importance, and the way of thinking of the surgeons. We should go back to the basics, technical tips in relation to vascular trauma, and this أحط إن شاء الله my experience في النقطة دي. Then we will go to the venous injuries, arterial injuries, mixed arterial and venous, pseudoaneurysm, distal flow analysis, in operating theater. Then we will conclude and we have a message to you. ان شاء الله تكون بسيطه وحلوه وريفرنسز موجوده. المحاضره ان شاء الله تبقى معاكم من خلال الميديا او يعني ان شاء الله توصلوا لها عشان ما ننشغلش بكتابه الكلام في المحاضره، ما تنشغلوش بالكتابه، لا ان شاء الله هتوصل لكم محاضره. Our patient increases the incidence of vascular injuries, as all we know, whether penetrating injuries or blunt type. These some injuries, and vascular injuries should be recognized and traced fast, because these injuries may produce major arterial or venous injury and end by amputation or even death. Penetrating and blunt vascular injuries represent a big challenge to the clinician. In the cases of management, they have a challenge. This challenge, we will make it simple today, and we will make the radiologist in synchronization with the thinking of the vascular surgeon. The vascular surgeon, orthopedic surgeon, or radiologist, all of this team should keep in their mind knowing the mechanism of trauma. The mechanism of trauma is of extreme importance for making the correct diagnosis. From this point of view, we should know that the peripheral vascular injuries may be penetrating trauma or blunt trauma. Like this, I will highlight here. Like this is a gunshot penetrating injury, and this is ecchymosis and maybe underlying fracture, which we call it blunt trauma. But penetrating trauma and blunt trauma should be well known by radiologists to understand what he will search about. And penetrating trauma usually obvious and can be treated rapidly. This is produced by gunshot usually or stab wounds. Usually results in what? Results in pseudoaneurysm, maybe arteriovenous fistula or vein thrombosis. While blunt trauma diagnosis may be delayed and disrupt more collaterals, and it is usually produced by fractures or fracture dislocations, and usually results in significant soft tissue injury, partial or complete vascular occlusion, and dissections, and sometimes intimal flap. Technical points of importance should also be known. And also it is already known to the clinicians. Management of peripheral vascular penetrating trauma involves assessment of many factors. They should assess patient stability, risk of limb ischemia, degree of tissue destruction, risk of infection complication concomitant major vessel injury. So that the radiologist should be oriented by the clinical words. I need to highlight for all my colleagues as in radiology to understand the word hard science and soft science. These words usually spoken by the vascular surgeon. Let us to know what is different. Vascular surgeons divide vascular injuries in this way. Hard sign of vascular injury, that means he see the patient and they see in this patient some signs, make that case diagnosis easy. And soft sign of vascular injury, these signs in the patient make the diagnosis in doubt and difficult. Let us to see the role of Doppler in these two types of signs. The second line, while in soft signs, the role of Doppler is of great help than in the hard signs. What are some of these signs? Like penetrating trauma on arterial cause with pulsating bleeding, that indicate that there is a lesion in the vessel. Pulsating or increasing hematoma, also, this may indicate that there is a lesion in the vessel. Profuse bleeding, acute ischemia, all these signs are strong enough to make the surgeon able to diagnose quickly. While these signs like fracture dislocation, fade up pulse, maybe due to venous thrombus, arterial thrombus, presence of flow with a fracture which compresses the vessel, make conflict between orthopedic surgeon and the vascular surgeon. All of these signs, like spasm, just compressed by fracture, all of these signs make the diagnosis is in doubt, so that they call it soft sign. When the radiologist hear the word soft sign, he should know that the Doppler comes first. When the radiologist know that the case in hard sign, the radiologist should know that Doppler comes second line in management, so that this Doppler will come. Let us go to what we have like Doppler machine, like imaging. I need to highlight on the imaging is our eyes on injuries. Imaging to see the injuries. I will repeat the word also in our field. Imaging is our eyes on the injuries. Let us to go to the what we can do by imaging other than Doppler. Although angiography is gold standard imaging modality for vascular disease, for vascular affection, remember that point of care ultrasound. I know many doctors in radiology sometimes ask me what is meant by focus. I need, so that I insist to put it in my lecture here. Point of care ultrasound nowadays is increasing, and they use it in emergency. Point of care ultrasound and the color Doppler are widely available, cheaper, non-invasive, and faster to obtain results. So that color Doppler sonography play an important role in decision making by accurate assessment of distal perfusion in cases of vascular injury and in follow-up observation. Doppler, I need all radiologists, especially the juniors, know that where the Doppler in the surgery, it means a small machine used in operation, like this is Doppler in their mind. In our field, we know that color Doppler ultrasound is different. Color Doppler is a built-in machine or mobile, and sometimes like cell phone, and it's pictured like that. All of us know this, and it's our code of objective in the lecture. CT angiography is very important also to ensure some cases, and digital subtraction angiography is a golden standard modality of choice. When Doppler is requested, and you will be the one in charge to do this study, especially in cases of treating vascular injury without cases. Remember that time is important. Your confidence and your accuracy is crucial. So back to Doppler basics. Remember, please get back to Doppler basics. What are these basics? I will describe to you. Doppler, or when I say Doppler now, I am talking about color Doppler. Doppler is used by two ways concomitantly, subjective and objective. Don't rely only on some measurements. You should rely on the flow and the measurements and. And Doppler is done by three arms. To reach three objectives, to be confident, accurate, and quick, you should use the three arms of Doppler. Sonography, which is B mode, then apply color, then apply spectrum. Doppler is a collective decision. Don't take a decision from only one arm. You should collect all to be confident, accurate, and quick. Doppler is a game of hemodynamics. Remember that you should review, or you should be alert by the hemodynamics of the artery, hemodynamics of the vein, and its type of flow, which is a high resistance or low resistance. Like that. Machine control is very important. Remember the BRF. The BRF to adjust the machine. BRF هو ميزان المكنة. I should adjust the BRF to reach the flow in artery and to reach the flow in vein. Phasic flow is very important in arterial ischemia and the lower limb examination. Direction of flow, remember to don't miss the color map to have a confident decision in the direction. I have some technical tips I need to deliver it to my juniors. Remember the portability. Usually, portability is very important in cases of trauma and in emergency. Use the portable machine. Infection also, you should keep away of infection. And remember that you use the superficial facial probe, which is very important, and frequency linear contributions. for better resolution in extremity vessels. Also, you can use low frequency group in some exceptions if patient is obese or there is a large hematoma, something like that. Adjust the machine setting is suitable for the region of interest. When evaluating the limb with vascular injury by color Doppler, my experience, I will highlight it in about 8 or 7 points. Review the clinical history and mechanism of trauma. These are very important. You should answer the message of the clinician. Remember that you are a clinician. I need you, after history, remember that you are a clinician. Build your sense. Put your hand, check the field and to feel the pulse, distal pulse. Explore the depth of the trauma, and will have to use two newly known method, which is 2-point fast Doppler protocol. 2-point fast Doppler protocol. If you have a limb with, if you have a case with gunshot injury, vascular injury suspected, direct to 2-point fast Doppler technique. It is a study done in 2017. Start by doing the two things: doing the dorsalis speed assessment, then posterior distal assessment. If there is triphasic, means no pathology in the regions before, and if there is a spectral study not triphasic, here or there, these are pathological. So you should go directly to use the standard full examination. Examination, you should go to B mode and review all the limb, then by color by B mode, and then assess the proximal and distal flow. You should go to assess proximal and distal flow. These steps will make you confident in your decision, and you will diagnose quickly. Also, if you are confused, go back to landmarks. Remember the landmarks of the anterior tibial location, proximal and distal, landmark of popliteal, landmark of the femoral, like that. If you are confusion, remember to do both, to compare right and the left limbs. Ultrasound is used to answer two basic questions. Remember, when you have a case with vascular injury, remember you should answer two basic questions. If there is a vascular injury you cannot find, repeat and be sure. يعني بقول شك في نفسك في شغلك أكتر من مرة علشان تبقى متأكد. طيب, if there is lesion or there is injury, detect its level and you should know its type. Types of injuries, which are venous injuries, arterial injuries, or maybe mixed arterial and venous. See partial or complete disruption, intimal injury, post-traumatic thrombosis. All of this we can see it. Incomplete disruption, remember, if the vein is completely disrupted, the vein will shrink. The vein compression by hematoma. This will make a difficulty. So that if you have a hematoma, there is a large hematoma, there is strong, and the vein cannot be seen well, the strong indicator of complete vein rupture is suspect. It's good to is anechoic and the vein is not compressible, and this is post-trauma partial venous thrombosis, and this is chronic thrombus with recanalization. And also here, this vein, there is venous wall detachment. This is a hematoma beside the vessels. These are some pathological cases. Let us go to arterial injuries. We know that normal arteries are rounded in shape and the echogenic wall, pulsating and non-compressible, while arteries of the extremities show also triphasic. Remember this triphasic, which is named high resistance fluid. This is the triphasic pattern. If it is lost, that means there is pathology. sure that if you lose triphasic pattern شك في نفسك 5 مرات. عيد التكنيك، ظبط الانجل عشان تطلع بفلو سليم. Any lost triphasic pattern is considered abnormal in cases of good technique. Arterial injuries, in most cases, blunt and penetrating traumas cause only a slight wall irregularity and sometimes intimal detachment, pseudoaneurysm, arteriovascular. Look at this intimal detachment here. Intimal detachment sometimes make disruption or interruption of the flow, or sometimes interruption of the color. Intimal flap management usually wait and see, sometimes with strict follow-up, and endovascular management may be proposed. Occasionally, these injuries can progress to arterial thrombosis, like this one, it is thrombosed artery. Also remember the retrograde flow. You will know this by a map. Remember the Doppler basis. If you have the defect in the detection of direction, you will have mistakes. In this case, there is a cutoff of the radial artery here, and the distal radial artery at this region filled from the arch, distal arch, by retrograde direction. Also, in arterial injuries, big problem you may see, like pseudoaneurysm, and all of us, we know that this sign is yin-yang sign, color swirl, to and fro. If you put the spectral sample volume at the neck, you will see to and fro spectral flow. To this case, radial aneurysm after gunshot 1 week before, it is seen by B mode, then by yin-yang sign, it is sure that this is a pseudoaneurysm. Also, another pseudoaneurysm here, you can see, but 2 minutes, okay. Also, this one of pseudoaneurysm was a metallic object. Every fistula, usually, you will find aliasing because of increased velocity, and every fistula, if you put your probe before the fistula, you will see low resistance flow. Anti-fistula, high flow. After the fistula, you will see the vein is arterialized. And this, also the color Doppler can be used to detect vascular occluder and follow up observation of the cases after management is very important. Color Doppler also has a role in the distal flow analysis. If you put your probe and you find triphasic, that means that it is very good sign. Color Doppler also used in operating theater for management, and it can be used as alternative complementary study to the angiography. It can help in decision making and confirm the result of reconstruction. Like this case during operation, it was stenosis diagnosed by Doppler from gunshot injury. In conclusion, in cases of doubt, imaging modalities will help in localization, diagnosis, management of trauma-related vascular lesion. However, and despite the injury, the angiography remains the gold standard, and still point of care ultrasound and calcular flow have gained popularity nowadays, and extremely vascular especially in means what I mean in conclusion, the role of point of care ultrasound, color Doppler ultrasound is increasing. They are non-invasive, widely available, reliable, and used in management and follow-up of the penetrating injuries of the extremity. My advice to my colleagues, I advise all of my colleagues, especially the juniors, to become well-trained in color Doppler sonography and focus, which is point of care ultrasound, to maximize the quick, confident, and accurate patient's effective care in cases of vascular injury in emergency. And these are great facts. And this is my trip in 2004 to Yemen. Please, I love Yemen. Please stop the war. I need you to be in peace like us. Thank you.
إن شاء الله نشوفك في المستقبل حاضر هنا مع أبنائك وأخوانك وزملائك استشاري الأشعة. اذا حد عنده كويشن للدكتور استاذنا الفضيل الدكتور احمد ابو الفتوح ممكن بس بسرعه يعني لانه المايكروفون يجيبوا له طيب يا دكتور استعجلي بس شويه اسمحوا لها المجال. اضربت انا يا دكتور.
لا بالعكس احنا استشرفنا جدا والله. استشرفنا.
درر علميه تخرج من ثناياك. شكرا.
Thanks for this lecture. I have two questions actually. The first one, in arterial spasm due to injury with fraction. Can you judge that this arterial spasm is present by Doppler, or you can't?
Yes, this question يعني directly go to the cases of doubt. I divided the cases two types. It's considered soft sign. The spasm is, you should go directly to the proximal region. If consider that the fracture is at the middle of the tibia, directly go to the proximal region and try to compare the proximal and the distal. Actually, sometimes if the spasm is continuous, you should make follow-up. My advice is don't rely on the decision at this moment on. You should make follow-up. If it is an emergency and like that, the clinician have other clinical signs that may help in the diagnosis. Using angiography, sometimes it's so difficult because the time issue. علشان كده حقيقي لما يكون في سبازم وانا بشتغل دوبلر في حاجه زي كده دي حدودي، هو قافل خلاص. ده احنا احيانا في باي ذا واي يعني احيانا لما كنا نيجي نعمل اندوفينس ليزر ابليشن ونخش بالسن، اول ما نخش بالسن الفين يسبازم ما نعرفش نجيبه تاني. فحقيقه السبازم بيعمل مشكله، ولذلك صبرا تطلعي فوق شويه تعملي اسسمنت للبروكسيمال ريجن من شكل الفلو في البروكسيمال فيسلز. يو شود نو اذا كان ماشي كويس فمعناه ان ممكن الدنيا تبقى تحت كويسه. لو كان مديني مونوفيزيك معناه ان ده سبازم بلس كومبريسد باي ايه؟ باي هيماتوما او اذا كان الفراكشر مأثر عليه. حقيقي السبازم مشكله، ولكن الصبر مع الحاله يقدر يطلع فايندنجز.
طيب the second question is about hand Doppler and Doppler machine. The specificity and sensitivity of hand Doppler for check injury of the artery or spasm. Same to Doppler machine. That means I can guarantee the result of hand Doppler. Same Doppler machine. Or I can depend it.
هاند دوبلر هم بياخدوا بس بالصوت وشويه حاجات، لكن الدوبلر ماشين بتاعتنا بتوريني احسن لاني بستخدم 3 ار، بستخدم بي مود واستخدم كلر وابقى شايف بحط ايدي فين. هو هناك بيحط ايده بالايه؟ بالسنس الجراحي على السيرفس اناتومي. انا حاطط ايدي على انتيرو تيبيال وبيقعد يسمع. طب لا، انا بالدوبلر بتاعنا ببقى شايف وحاطط السامبل فوليوم في الارتري بالظبط وابقى متاكد اكتر. السنسيتيفيتي بتاعتنا اعلى، بتاعت ان انا احط الكلر دوبلر بتاعنا بتبقى اعلى بكتير من الهاند دوبلر اللي هو الدوبلر بتاع الجراحه او البنسل لاين بنسل ماشين.
I mean in worse situation I can depend on hand Doppler or can't?
In worse situation, if you don't have color Doppler machine, use the Doppler machine, the Doppler hand Doppler.
So the result of hand Doppler I can depend on?
حقيقي انا احب الكالر دوبلر ماشين الكامله احسن من الهاند دوبلر. ودلوقتي الهاند دوبلر اي ثينك مع الوقت هيتغير، لان احنا معانا دلوقتي ايه؟ الكالر دوبلر ماشين بقت زي الموبايل فبقت بحجم التاني، فمع الوقت هتتغير. فانا عندي حاجه اشوف فيها احسن من ان انا احط وابقى ماشي باني كلامي على حاجه ضمنيه.
Okay, thank you.
شكرا دكتور.
ثانكس دكتور. ألف شكر. سعدت بالحديث والاستماع لك دكتورنا العزيز. إذا أردت أن تستمر في متابعة مؤتمرنا كان تستطيع من خلال ستسمعنا صوتا وصورة. السلام عليكم دكتورنا العزيز.
عليكم
ألف شكر دكتورنا.
شكرا. السلام عليكم.
Thank you very much, Doctor. And now we are with Dr. Abir Shargib, the consultant radiologist.